Hello, it's me, Dr. Catherine Toomer, Talks on Tuesday. And I have a wonderful episode today with Dr. Tonya, and it's Caylor, right? Is
Yes.
pronounced it correctly, yes.
Yeah.
Dr. Tonya Caylor, who I'm just going to let her introduce herself, tell you what she does, and then we're just going to take it from there. So
All right.
thank you for joining
Th-
me.
Thank you for having me, Dr. Toomer. I am Tonya Caylor. I'm a family physician up in Anchorage, Alaska. I primarily am an academic physician coach. And what that means is I partner with family medicine residencies and really work with the physicians, the residents, and the faculty members to really navigate these very challenging times in medicine in a way that serves them where they can enjoy their chosen careers and love all of life, right? And integrate that well. So that's what I do as my full-time job. I still fill in at our local FQHC in our precept with our residents in Anchorage often as well. So thank you for having me, and I'm loving your background and all the books. This is
Oh,
amazing.
yes. This is my little mini library slash office. So, and I don't sometimes I start talking. I did introduce you as Dr. Tanya Kaler, didn't
You
I?
did, you
Okay.
did.
All right. Because sometimes I'm a stickler about that. So, as a family physician who often gets called a nurse, and that's not a problem. I mean, I love nurses,
Right.
but I'm just not one. So, or a janitor, that's also happened. um, or the food lady. Um, so when you talk about coaching, because I'm also in family medicine, community health,
Yeah.
so I worked almost my whole career in FQHCs. And so I understand the difficulty of really being you're kind of part psychologist, part social worker, part physician.
Yeah.
How do you help people navigate well, one, your doctors so that they can better help their patients. But then also, how can people then communicate more effectively with their doctors in a way so that they don't seem distracted and don't feel like they're, being bombarded with too much at once and
Yeah.
they can help them for what they need?
Yeah, those are a great questions. So I'll start with the what I work with the physician on the physician standpoint. As you well know, and most of your listeners do too. Right now, there's so many challenges in medicine that there is a lot of
Mhm,
burnout, right?
mhm.
And burnout shows up in the way that the physician is just emotionally exhausted. They're starting to have depersonalization and start to feel like they're not really making a difference. And so that might be one way you might recognize if your doctor's personality has changed or something's going on. That may be what you're seeing. But we know that about 80% of the cause of that is the systems, right? We all know the
Mhm.
system is not working well for anyone,
Yeah.
especially for our patients. And so, because of that, what that leaves me is about 20% to help partner with the individual to really work on their mindset. So, despite the challenging circumstances, how can they show up in a way that they're not overwhelmed and how they can be present with the person or task in front of them, and starting to like reset that negativity bias. So, really,
Mhm,
when we have kind of a cleaned up mindset, right? Like we don't,
mhm,
you know, like let our thoughts just live in their wild, going unchecked,
mhm.
then we can start to make sense of things again. And then we can become influencers within the system to say, hey, this 80% is not working. For this job, I need these resources, right? So that's kind of the big part of what I do from a coaching standpoint.
Okay.
Your question about how do patients show up and um, maybe not add to the stressors. Number one, I want you
Yeah.
to know that no matter how much you love your physician, you really can't control any of that for
Mhm,
them.
mhm,
So I think you just do what you can. If you're going to the physician, then I'm assuming that you are either keeping up with your health maintenance, and kudos to you for doing that, or staying on top of your chronic diseases. And again, kudos for you doing that. Or you're in a situation where you're not feeling well and you really want a partner to help you figure out what's going on and what are the ways forward. So, as much as I appreciate that you do think about how your doctor's feeling, the most important thing is to show up and be able to get your needs taken care of. With that being said, I would have very clear goals for your appointment. Like,
Mhm.
what are your number one and number two goals? The way healthcare is structured today, we would all love to have 45 minutes with each patient because
Mhm.
medicine is so complex and patients are so much sicker these days. We
Yes.
really could utilize that well. But the way it's set up is most of us get 15 to 20 minutes and we have
Mhm.
to get our notes done or we're doing it while our kids are doing their homework, right?
Yes.
So make sure you're clear about what the biggest things that you want to walk away with, and kind of really partner with your physician and their team to make sure we kind of systematically work through the most important things to you. And chances are your doctor has one or two top priorities that may or may not align with you, and you can partner together to kind of um, co create that visit. So,
That's really wonderful and very important. So I'm just going to reiterate that again, in case anyone's just tuning in or they is that it's really important to have your goal in mind. And I think that's actually a good bit of advice just going into any situation, really.
yeah.
Um, and so, but you mentioned something earlier about the talk that's going on in your head.
Hmm.
And as many people who've watched me know that I did a TED Talk on imposter syndrome, and I talk a lot about
Yeah.
that stuff going on inside your head and how, we can fool ourselves into believing things that aren't really true. And we can also talk our way out of things that are true. So when you are coaching with
Hmm.
people, because I'm sure what you do with residents can be applied to other people in other situations,
Hmm.
how do you help them get over that self-doubt, that negative self-talk?
Yeah, there are several different steps, and so I kind of partner with them to start. One
Mhm.
is the very first thing is awareness, because the way our brains are wired, we just accept everything that we think as truth, and we rarely examine them.
Mhm.
Those thoughts, I mean, and so really starting to tune in. What are you telling yourself? What thoughts are you rehearsing over and over and over again?
Mhm.
Because awareness is key. And so if the thought is, I'm fooling everybody, I really don't know anything. If the thought is, I'm not good enough. If the thought is, somebody else should be doing this because I don't feel like I'm doing it well. Like those are thoughts, right? And so you want to really like look at it. And so I think the first thing is awareness. What is the negative self chatter? And then I think the second thing is when you look at those thoughts objectively, and I recommend you write them down. There's something that happens when you write things down, you take them out from this free form, vague
Mhm.
stuff onto paper, and you move it away from your emotional centers in your brain over to your verbal cortex, which is your thinking, like your executive functioning thinking part. You write it down. Then you get a little more distance and you can see things a little bit more objectively. And then you're like, oh, oh, well, that's silly that I was thinking that, right? Or, oh gosh, that was really harsh. I can't believe I'm talking to myself that way. I would never talk to anyone
Mhm.
that way.
Or
And then
allow
you start
anyone
to
to talk
realize,
to us that way.
oh, yeah, right. And so I think those are a couple of big things. It's
Mhm.
to awareness, tuning in what's going on. What are your thoughts? Where are you letting your thoughts drift? And number two, kind of looking at them objectively,
Mhm.
because we have more agency over how we experience the world than we give ourselves credit for. And that goes with
Agree.
kind of deciding where we're putting our focus.
Mhm. I actually talk about this a lot, as most of you know, and I'm sure you're also aware. Um, I I do weight loss. People say I do weight loss, when really it's mostly a lot of counseling and coaching.
Yeah.
Um, and so because usually what it is convincing people they can actually do what it is that they want to do. Um, and so when people are afraid, when they're fearful, um, I find that the two biggest, and you can correct me if I'm wrong, or if you see the same thing, fear and guilt. seem to be two of the biggest things that kind of hold people back. Guilt because they're angry with themselves, and then guilty because of that anger. How do you help people overcome fear? You mentioned writing it down, kind of putting it out there to get a little more, objectivity, but the actual steps of
Yeah.
overcoming it.
Yeah. And I think you have to start telling yourself the full truth often. And one of the things is what's your like think about why are you fearing fear?
Mm,
Like, right? Because if we try to avoid all unpleasant emotions, then we get
mhm,
ourselves in a whole heap of trouble. Allowing fear to be there and seeing it as it's the like I like the because often it's a fear of failure, right?
mhm,
And so if we when we're afraid of failing, of course we're afraid of failing. Nobody wants to fail. And if we can just step into it and realize that fear is just an emotion that we feel in our body, right? So, I mean, we get on roller coasters, we read books, we watch movies to experience that on purpose, right? And so we can survive that discomfort.
mhm.
And I like the an acronym FAIL, first attempt in learning, right?
Yes. Nice.
And every new thing is outside our comfort zone, and that's
Mhm,
where we sometimes have to allow fear to be there. I think that's one of the big things. I
mhm.
like to do what's called a fear setting exercise. Again,
Oh,
this goes with writing it down.
okay.
So think of the one thing that you are afraid of trying
Mhm.
and write down all the things that are potential bad outcomes. Like, what
Huh,
are all the things you're worried about? And
okay.
then what do you think? Like, once you write those down, you might see that one or two are like, oh, I don't know. Jupiter might run into Earth and the whole thing explode. Oh, okay, maybe that one's a little out there. So you start to work. But then you can, the second column is for each one of those, write down 1 to 5 preventative steps
Hmm,
to prevent those things from happening.
okay.
And then in the third column, worst case scenario, that bad thing happens. What are
Then
one to
what?
five fixes to that bad thing, right?
Hmm,
But once you do that, it kind of expands hope.
hmm. That's actually very practical, and thank you for that. Um, so I can you mentioned that you coach. I can tell that you coach. You gave some really good advice. So how important really is coaching? I mean, since the onset of the pandemic, we've seen an explosion of coaches and everything that we didn't even know we needed coaches for. But what would you recommend someone who says, if I've never had a coach before,
Mhm.
what should I do? Should I get a coach? And if I do get a coach, what should I expect from that coach? Maybe should it be, how do I decide which type of coach I should get? Is that something
Yeah.
that do you help your residents with that, like sort of beyond you? Where do they go next?
Yeah. So I think there's a few ways to look at coaching. Number one, for those of you who like never knew anything about coaching, then suddenly
Mhm.
everything around you there's coaching.
Yeah.
Um, I want you to know that coaching has been around for decades, primarily in the C suites at Fortune 500 companies, because they knew how important having, and I'm going to call it a thought partner, and that's basically what we are as coaches
Mm,
at those high level, high stress jobs, like how much more effective is. And so, as a thought partner, what I do is just that. I believe that every single person I'm working with is whole, capable, and resourceful. I'm not there to give them the answers. I'm not there to be their mentor. Mentors are great. I encourage everybody to have one. But a coach brings something different. It's a belief that you have your own best answers, and I'm partnering with you to find them, to get rid of the limiting beliefs that are in your way, to help you get clarity, to kind of help you see things as the external observer. I'm able to see things sometimes more clearly than even when you write it down yourself. But so it's hugely important. I'm limited to understanding it from in the medical realm of how it
Mhm.
helps with physicians, but it
Yeah.
decreases burnout, it prevents burnout, it improves self-compassion, it decreases imposter phenomenon, and we don't
Yes.
use that word syndrome anymore,
Syndrome, yes.
right? Because it's
Which
not
was
a defect.
actually and then which was the actual original,
Right.
phrase
Yeah.
for it, was not syndrome. That kind of
Yeah.
morphed into this from somewhere, I don't know where.
Yeah,
But
it's really interesting. I because I use the Clance imposter scale. I wrote to Dr. Clance, who described it
mhm,
originally, to get permission to use it, and she said only if you spell it correctly. Guess she doesn't like the way it's spelled. And number two, do not ever call it a syndrome. And so
mhm.
I honor that and
Yes,
call it phenomenon.
yes.
But yeah, so I think there's also increased improvement in quality of life.
Mhm.
Like, who doesn't want that, right?
Yeah.
Just from having a thought partner to help you get out of your own way and kind of move forward with your own best answers.
Yeah, okay. So I have a question because
Yeah.
I have a business coach. I think we kind of we share a business coach. Um,
Yes, we do.
and yes, so I have a business coach and I have a mindset coach,
Yeah.
who is a psychiatrist. So he kind of help. It's kind of a more for mindset coach, counseling sort of thing.
Yeah.
Who are your coaches?
So, well, my business coach,
Yes.
and
And I'm
my
going to say
personal,
her name because everyone should, any physician watching who ever even thought about having a business, Dr. Una and the Entre MD Business School. Go ahead.
yes, absolutely phenomenal. Um, and my regular life coach is, I have a couple. My main one
hmm
is Dr. Ali Novitsky.
Okay.
And
Yes.
so that's how I hired her as a career coach,
hmm
and uh, ended up in this world, which was just, she just was able to help me get to where I needed to be to reconcile the concerns I had about trainees.
hmm
Um, and then I have a couple of dear friends, Dr. Michelle Dorfsman and
hmm
Dr. Amelia Beakey, who
Okay.
um, we sometimes have each other on speed dial for PRN coaching.
Okay.
So,
Well, that's
yeah,
fantastic.
but to your point about how do you know where to start,
hmm
I would start word of mouth. To me
hmm
is really important.
Yeah.
So I would kind of start there, start with where you contacts are. You can look, but I would say almost all the coaches that I'm familiar with will meet with you virtually or by phone before you make any commitments, so you can ask them questions, get to know them. Some of them even offer a free mini coaching session, so you really experience it. Because just like when you go to look for a doctor, it or a therapist, right? Like, you really want to make sure you click with the person.
Yes, exactly.
Like you have to have psychological safety and trust in that
Yes,
relationship to
exactly.
maximize the benefit.
I agree. And before we go on, I just want to say that Dr. Una is here and she says hello, doctors, and lots of heart emojis. And and for anyone who doesn't know, you can also go to my page and look at this, or go to the UnTrimD Physicians in Business page. There is a visibility um, workshop going on right now, and it is actually the way that I grew my business. I we've been working together for some time, so that's how I ended up where I am right now. So if anyone wants to be where I am right now, you've got a blueprint going on as we speak. So, um, so I have a question. So if someone now, do you first of all, do you work with only residents within your system, or is residents from anywhere,
So I work with
or
family medicine residents and faculty.
and
So
faculty? Okay.
I will work with them individually, but primarily, I really feel like it it's really beneficial when the program invests in coaching on behalf
hmm
of their whole team. And
Okay.
so primarily, I work with the groups, residency programs.
Okay. And so if some and that's anywhere in the United States, or is that in the
Mhm.
world, or is just in the United
Primarily the
States?
US, yeah.
Okay. Okay. And if someone wanted to work with you on behalf or contact you on behalf of their program, what should they do?
Oh, they can reach out to me on my website, which is joyinfamilymedicine.com. And on there, you could, there's a couple of ways that you can contact me. And I will say that not all residency programs are quite to the point where they're ready to have an external coach.
Mm-hmm.
But uh,
There we go.
if you know someone, let them know.
Mm-hmm.
And otherwise, I do work with individuals when their programs are not ready.
Okay. All right. And if for individuals who would like to work with you, then they should also contact you through your website.
Yeah.
Okay.
Yes. Perfect.
All right. And at what phase should residents contact you? Are we talking interns? Because we all know an internship year, it's like
No.
crazy. So, I mean, is this something for anywhere because in family medicine, I mean, it's 1, 2, 3, or where would be the best time then to
I
contact
think
you?
really there's benefit to be had even at the intern level, although
Mm-hmm.
most programs intern schedule it may make it challenging, but I'm willing to
Mm-hmm.
work with your schedule.
Okay.
But really, primarily the second and third years are the ones that get to take advantage of coaching more often than
Okay.
the first years.
All right. Okay. Well, this went quickly because I thought, surely we were going to run over, but is there anything else you'd like to add or anything you'd like to ask me? I don't know, but that you just
Well,
want the world to know about, um, you know, who is Dr. Kaler and whatever. I'm just let it flow.
yeah. So, I mean, I think I've given you a glimpse of who I am. I think
Hmm.
I haven't held anything back. I will say, Dr. Tumor, that I really appreciated your TED Talk,
Hmm.
along with that HBR article that came out, and then recently the New Yorker, in kind of giving a much fuller
Hmm.
perspective on
Yeah.
imposter phenomenon, because
Hmm.
I think that there's a lot to be said about how individual groups and the structural issues really play into that. And I think that's an
Yes.
important message to get out.
Hmm.
So thank you for bringing that message forward. And I wonder if I could plug, I'm not an affiliate. I'm wondering if I could plug a book
You can
for
plug anything you
anybody.
want.
Yeah. So
In
for
fact, I'll
anybody who is
type it in somewhere. Go ahead.
really struggling, where they don't feel like it's just the normal, typical run of the mill self doubt. They really feel like at any moment you could be found out to be a fraud, that kind of really intense kind of doubt. Doctors Lisa and Richard Orbe Austin um, wrote a book called Own Your Greatness. And they do a great job of understanding the systemic things that go into it. And it's like a workbook. You can work right through it. It's really great. So I recommend that. And I'm not an affiliate. I just believe in the book so much in them and their research.
I'm just gonna put it along. There we go.
Yeah,
And I'm
great.
gonna turn. Where did I do this one? I am all over the place here. But nope, that's not the one. There we go. Okay.
Look
Makes it
at
easier to see.
your mad technology skills. I'm
I know,
impressed.
I've just been like, ooh, so cute. That's actually that's great. And one of the things I do talk a lot about is actually how imposter phenomenon affects health.
Yeah.
And there is a direct connection between what we tell ourselves and how we feel about ourselves and then how we feel. And so I do, and so I appreciate that having a workbook would be great actually for people who are in that position. So, well, thank you so much for coming and speaking to us. And I will make sure that you have access to this, and then if you want to post it anywhere, and also if there's anything you'd like me to add in terms of contacts, I'll be more than happy to do that.
Okay,
So
great. Thank you, Dr. Toomer. Thank you for all that you do in
thank
the
you for
world with
coming in.
patients too. All right.
Oh, thank you. I'm just gonna end it. Oops. Is it so much for technology? Now I can't figure out how to turn this off.